Good day to all of you. This is Dr. BK for you, and today I am going to discuss about the introduction to the perineum and about the superficial perineal pouch. Now, with respect to the perineum, first we will discuss about the short introduction and boundaries and subdivisions of the perineum. So what are all the surface boundaries and what are all the skeletal boundaries of the perineum? So followed by that we will discuss in detail about the superficial perineal pouch, the contents of the superficial perineal pouch in males and females, in boundaries, what are all the muscles, vessels and other structures which are present in the superficial perineal pouch. And then finally we will conclude with the applied aspects. Now, what actually is the perineum? So perineum is actually that part of the region which is present below the pelvic outlet. Of course, the pelvic outlet is a diamond shaped outlet and it is closed in the recent state by the pelvic diaphragm. So the muscles forming the pelvic diaphragm, and it is pierced by the urethra, the rectum and the vagina in between the urethra and the rectum in case of the females. So below the pelvic outlet, what you see, the perineum starts, and it mainly consists of the external genitalia. So on the surface, it is actually the space which is present between the medial part of the upper part of the thigh. So in between the upper part of the thigh, medial surface. So this area is actually called as the perineum. So as such, any region, it is actually lined by the skin, and ventrally it is limited by the scrotum. Now, one major division with respect to the perineum, as you see with respect to the males and the females both. In the males, it is fused in the midline, and the line of fusion is represented by a raphe in the skin, midline raphe, which extends along the scrotum and also along the ventral surface of the penis. Okay, and the deeper structures also, they are fused in the midline. But whereas in case of the females, the line of fusion is absent, it is not fused and there is a cleft in between. So mainly what you are seeing the structures is the vestibule. So in the midline, what you see is the vestibule, and on either side what you see the unfused part is the labium majora, and then what you see is the labium minora. So between the two labium minora, what you see is the vestibule. Okay. So now, what are the superficial boundaries? So that is the surface boundaries. So anteriorly in males, it is limited by the scrotum and by the mons pubis. So this raised area is actually called as the mons pubis. In females, in males it is the scrotum, and behind you have the buttock region with the natal cleft posteriorly, and on either side we have the medial surface of the thigh, upper part of the medial side of the thigh. Okay, so that mainly forms the boundaries of the surface boundaries. So superficially, when you look at it, these are the boundaries, and it is definitely lined by the skin. Now coming to the deeper or the skeletal boundaries, the perineum, anteriorly it is by the lower border of the pubic symphysis with the arcuate pubic ligament. Okay, it is also called as the inferior pubic ligament anteriorly. Posteriorly, what we see is the tip of the coccyx. And on either side, what we have is the ischiopubic rami. So what you see is the ischiopubic rami anterolaterally, and laterally what you see is the ischial tuberosity. Okay, So this is the conjoined ischiopubic rami, and that is the ischial tuberosity. Posterolaterally, what we see is the sacrotuberous ligament. Okay, so these are the deep or the skeletal boundaries, so which forms the framework of the perineum, which is going to give attachment to the muscles of the perineum. Okay, so the pubic symphysis, lower border, conjoined ischiopubic rami, ischial tuberosity, and what you see is the sacrotuberous ligament and then the tip of coccyx. So it is a diamond shaped because it corresponds to the shape of the pelvic outlet, and it is immediately situated below the pelvic outlet. So this is actually a posterior-anterior view, what you are able to see here. Now, if you look at the perineum, for the sake of convenience and for the understanding of the structures, so which makes it very easy for the description, the whole perineum can be divided by an imaginary line passing along the ischial tuberosities. So if you connect an imaginary plane connecting the two ischial tuberosities, then the whole diamond shaped perineum can be divided into two triangles, anteriorly the urogenital triangle. So the anterior triangle is called as the urogenital triangle, and the posterior triangle, what you see is the anal triangle. Okay, so the anal triangle is actually perforated by the anus. So in the anal triangle, mainly you consist of the anal orifice and perineal body which intervenes between or in front of the anus. Then you have the anococcygeal raphe and the tip of the coccyx, and on either side you see the ischiorectal fossa. So that is about the anal triangle. It is the urogenital triangle which lodges your external genitalia, and the urogenital triangle consists of the two pouches. One is called as the superficial perineal pouch, and other one is the deep perineal pouch. Okay, so that is what an imaginary line which divides into a front or anterior urogenital triangle, which is pierced by the urethra and vagina in case of the females. Posteriorly you see the anal canal surrounded by the sphincter ani externus, and on either side this space is the ischiorectal fossa. So in between the opening of the anal canal and the vaginal canal, you see the perineal body, which is exactly situated at the junction of the urogenital triangle and the anal triangle. So that is the anococcygeal raphe, and then what you have is the tip of the coccyx. So basically it is divided into urogenital triangle and the anal triangle. Okay. So structures in the urogenital triangle, as I told you, mainly consist of the anal canal and the sphincters of the anus, external anal sphincter and ischiorectal fossa, and more deeper plane what you are seeing is the pelvic diaphragm. In front, especially in males, what you see is the bulb of the penis in the center, which is covered by the bulbospongiosus muscle, and that is the crux of the penis, which is actually called as the covered by the muscle, which is called as the ischiocavernosus. So corpora cavernosa, and this is corpus spongiosum, and this will be actually traversed by the bulbospongiosus, will be traversed by the spongy part of the urethra, and you are able to see again a midline septum which is fused. So the bulb of the penis is fused, whereas again in females you can see it is not fused, and that is the superficial transverse perineum. And here you are able to see the perineal body, so where the intersection of the muscles takes place. It is a fibromuscular node which receives the muscles of superficial perineal pouch, and also the deep perineal pouch, sphincter ani externus, and the levator ani in a different strata. Okay, so that I will be discussing in the deep perineal pouch about the perineal body. So bulb of the penis and crux of the penis, bulb of the penis, even though it is bipinnate, it is fused, and you are able to see the median fibrous raphe, the line of fusion. Okay, so that is the borders for you. And in the females, as I told you, the bulb is not fused, the bulb of the vestibule is not fused. Okay, and it lodges the vestibular opening, which consists of the urethra and the vaginal canal in case of the females. So now coming to the urogenital triangle, as I told you, in males it lodges the penis. So the body of the penis, so root of the penis, then you have the crux of the penis, and then you have the shaft of the penis, and then you see a raised margin which is called as the corona glandans, and then you have the expanded glans penis, which is pierced by the external urethral orifice. Spongy urethra traverses through it. Okay, and in case of the females, you are able to see the labia majora, that is the minora. The vestibule you are able to see. So here you are able to see the bulb of the vestibule, and in the vestibule you have the opening of the urethra and the vaginal canal, and that is the clitoris. In case of it is actually regarded as the female penis. Okay, so more detail about the external genitalia, again kindly refer to my external genitalia class in the abdomen. Now deep to the skin, so you have the skin, and then deep to the skin you have the superficial fascia of the perineum, which is called as the fascia collis. So it is actually a continuation of the fascia scarpa, so we will see that. So anterior abdominal wall, deep to the skin, you have a fatty layer which is called as the fascia of camphor. This is called as the camphor's fascia. So below the line of umbilicus, what happens midway between the pubic symphysis and umbilicus, you will be able to actually appreciate the two layers of the superficial fascia, that is the camphor layer and the deep membranous layer, which is actually called as the fascia scarpa, the deep membranous layer. Okay, and this fascia scarpa does not cross beyond the thigh because it is attached to the fascia lata of the thigh. So kindly just excuse for the spelling mistake. It is during typographical error, it has come as fascia later. It is actually fascia lata of the thigh. So it fuses with the fascia lata of the thigh, that is the line of fusion. But medially, if you look at the scarpa's fascia, it actually continues as the fascia collis or the superficial fascia of the perineum, and this fascia collis lines the superficial perineal pouch and also continues with the scrotum, the darkose layer of the scrotum. Then actually it is continuous with the fascia of the penis, and what happens finally, it goes and gets attaches to the posterior part of the perineal membrane. So thereby it forms the anterior most boundary of the superficial perineal pouch. So now we are able to see the skin, deep to the skin, that is the superficial fascia. So the superficial fascia, as I told you, it is continuous with the fascia of the penis and also to the darkose layer of the scrotum. So deep to the fascia camphor, you have the scarpa's fascia continuing in the superficial perineal pouch, continuous with the fascia of penis, and then if you trace it, it is actually continuous with the fascia of the scrotum, darkose layer of the scrotum, and then finally what happens, there it goes and fuses with the urogenital diaphragm, inferior fascia of urogenital diaphragm, that is the perineal membrane. So there it fuses. So it is closed behind. Below also along the scrotum and the penis it is closed. The only place where the superficial perineal pouch is open is anteriorly, so it actually communicates with the superficial inguinal space, which is between the fascia, scarpa and the aponeurosis of external oblique muscle. External oblique abdominis. So between these two is the superficial inguinal space. Anteriorly the superficial perineal pouch. This perineal pouch communicates with the superficial inguinal space of the anterior abdominal wall. So okay, behind you are able to see it is fused with the urogenital diaphragm, inferior fascia of urogenital diaphragm, that is your perineal membrane. So this is your superficial perineal pouch, and this is your deep perineal pouch, which consists of again two muscles, and you are able to see the bulbourethral glands in the males alone. Females, you don't have bulbourethral glands. Instead of that, you have the paraurethral glands or the greater vestibular glands. So that is the superficial fascia of the urogenital diaphragm, and again both the fascia are fused. So the deep pouch is a completely closed pouch, whereas the superficial pouch is open only anteriorly and above, and the remaining it is completely also closed. So far I have described about the superficial fascia, the same thing. So the fatty layer and the membranous layer. So superficial fascia of perineum is nothing but the continuation of the scarpa's fascia, as the Colles fascia attaches to the urogenital diaphragm, as I told you. Then laterally to the margins of the pubic arch and ischial tuberosity. Anteriorly it is actually continuous with the dartos layer of the scrotum, fascia of the penis, and then the scarpa's fascia. The deep fascia, it is the superior fascia of urogenital diaphragm. So here you are able to see the superior fascia of urogenital diaphragm, and attaches to the posterior border of urogenital diaphragm, laterally to the pubic arch, and in front fuses with the inferior fascia of urogenital diaphragm. So the superior fascia fuses with the inferior fascia of urogenital diaphragm. So this urogenital diaphragm and these two facial layers again I will be discussing in the deep perineal pouch class. Okay, so that is the deep fascia, which forms the superior fascia of urogenital diaphragm, that fuses with the perineal membrane posteriorly and also anteriorly. Laterally it is actually stretching across the pubic arch. So we are able to see that is the perineal membrane, which is stretching across the pubic arch, ischiopubic rami, and anteriorly it is thickened to form the transverse perineal ligament. So posteriorly it is closed, it will fuse with the superior fascia of urogenital diaphragm. So it is a closed space, this deep pouch, which is lined by fascia above and below, whereas this you are able to see the superficial perineal pouch in case of the females. So your urogenital triangle or the urogenital region, basically, as I told you, consists of two spaces. One is the deep perineal space, and other one is the superficial perineal space. So this space is lined by two layers of fascia above and below. So the superior and inferior fascia of urogenital diaphragm, whereas the posterior boundary or the posterior superior boundary of superficial space is the perineal membrane, and the anterior boundary is the fascia Colles, or the superficial fascia of the perineum. Okay. Now coming to the boundaries of superficial perineal pouch. So this is the superficial perineal pouch. Anteriorly, as I told you, it is the fascia Colles. So superficial or anterior, it is the Colles fascia. Perineal membrane forms the deep boundary. So posteriorly it is the perineal membrane, where the Colles fascia goes and attaches to it and thereby closes the pouch posteriorly and superiorly. On each side you have the ischiopubic rami, and it is closed by the perineal membrane fusing with the Colles fascia posteriorly. As I told you, anteriorly it is open and continuous with the space of the scrotum, and penis, and also the anterior abdominal wall between the fascia scarpa and the external oblique aponeurosis. Okay. So continuous with the fascia of the scrotum and penis, and continuous here in the anterior abdominal wall between the fascia scarpa. This is fascia camper, fascia scarpa, and aponeurosis of external oblique abdominis muscle. So in females, that is the superficial perineal pouch, and that is the deep pouch, where the fascia collis attaches to the perineal membrane posteriorly. And mainly it consists of, instead of the scrotum and penis, you see the vestibule and the greater vestibular glands, and that is the ischiocavernosus, bulbospongiosus, very small and reduced ischiocavernosus and bulbospongiosus, which is present deep to the clitoris. So clitoris is the erectile tissue in case of the females. In case of the males, what we see is the bulb of the penis, and that is the crux attached here to the, mainly to the perineal membrane and root of the penis. They all form the shaft of the penis. So this is actually covered by the ischiocavernosus and the bulbospongiosus muscle. So the contents in case of the female, labium majora, as I told you, and then next is the, we are able to see the labium minora. So body of clitoris mainly made up of two corpora cavernosa by an incomplete septum and a small bulbospongiosus. Okay, bulb, you are able to see bulbospongiosus. So 2 centimeters behind the clitoris, you see the opening of the urethra and then vaginal orifice. These two are situated within the vestibule, and the bulb of the vestibule on each side of these unites and gets attached to the glans clitoris. Okay. So this is actually not fused, it is the unfused part in case of the females. So mainly the muscles which are covering the ischiocavernosus muscle, covering the corpora cavernosa of the clitoris, and then what you see is the bulbocavernosus muscle, this part, so covering the bulb of the vestibule. Okay, bulbocavernosus covering the bulb of the vestibule, and then you have the superficial transverse perineum, so which is actually from the ramus of ischium to the perineal body. It stabilizes the perineal body, superficial transverse perineal muscle. So that is the superficial transverse perineal. This is the ischiocavernosus, the bulbospongiosus, and the superficial transverse perineal. They are all supplied by the perineal branch, muscular branches. Perineal branch S4 nerve. Nerves, mainly in females, you consist of posterior scrotal in case of males, here labial nerves. Then you have the bulb of the vestibule, nerve to the bulb of the vestibule. Muscular branches to the muscles, as I told you, the superficial muscles which are present in the superficial pouch, ischiocavernosus, bulbospongiosus, and the superficial transverse perineum. Then perineal branch from the posterior cutaneous nerve of the thigh. So it is actually a perforating branch. So here you are able to see the posterior scrotal or the labial nerves. Then muscular branches from the perineal nerve. Then perineal branch from the posterior cutaneous nerve of the thigh. Okay. So that is the perineal nerve which is giving muscular branches. Posterior scrotal or labial nerves. Then you have the perineal branch of the posterior cutaneous nerve. With respect to the vessels, the blood vessels, mainly again posterior scrotal labial vessels. Then you have the transverse perineal artery. Then 4 branches from the artery of the clitoris are deep artery, dorsal artery, artery to the bulb of the vestibule, and urethral artery. Okay. So these are all branches from the internal pudendal artery. Okay. So here you are able to see the posterior labial artery. The next one you are able to see is the transverse perineal artery, which is actually coming from the prudental artery, transverse perineal artery, posterior labial artery. Then artery to the bulb of the vestibule. Then terminal branches, deep artery and dorsal artery. So deep artery and dorsal artery of the clitoris. So these are the terminal branches of the internal pudendal artery. That is the internal pudendal artery which is giving its branches. Then apart from the vessels, muscles and nerves, we have the glands and ducts, greater vestibular glands of Bartholin. So these are the greater vestibular glands of the Bartholin glands. Their ducts are seen on either side of the vaginal orifice opening into the vestibule. So these are the vestibule and this is the greater vestibular glands of Bartholin and their ducts opening into the sides of the vagina. Now coming to the contents in case of the males, so mainly it consists of the bulb and the crux of the penis. The starting point is actually called the root of the penis, made up of the two corpora cavernosa, and the corpora cavernosa consists of the ischiocavernosus muscle, and then the bulb consisting of the bulbospongiosus. This will be traversed by the urethra. So the bulbospongiosus is fused, forming a midline raphe. Ischiocavernosus muscle covering the corpora cavernosa arises from the ischiopubic conjoined ischiopubic rami. Now, these muscles, what happens is the corpora cavernosa consist of cavernous spaces. So, during the erection, this muscle constricts the cavernous spaces, and thereby what happens is it helps to retain the erection of the penis in the males. So in the males, what happens is the cavernous spaces are actually filled with the blood. Okay, and then what happens is the impedance of venous return. So after the filling of blood till the time of venous return is the time of the erection, which is a vascular phenomenon. We have the bulbospongiosus covering the corpus spongiosum, and it arises from the perineal body, and it has got three sets of fibers. So the dorsal fibers, you are able to see it is continuous with the opposite side and seen on the dorsal surface. Median fibrous raphe, it is attached here to the median fibrous raphe. Both are fused. The bulbospongiosus of the both sides are united by the median fibrous raphe, and it is actually traversed by the spongy urethra, the bulbospongiosus. So the bulb of the penis is actually traversed by the spongy urethra, and the deep fibers are present between these and the deep dorsal vein of the penis. Okay, so they are mainly responsible again for the erection, and at the same time they are also responsible during ejaculation, the repeated contraction of this urethra, mainly during the ejaculation of the seminal fluid. Then you have the superficial transverse perineum arising from the ramus of the ischium and getting attached to the perineal body. So this mainly stabilizes the perineal body. So both the superficial transverse perineum and the deep transverse perineum. Okay. So you are able to see in a coronal section, so around the bulb of the penis, the bulbospongiosum traversed by the spongy part of the urethra, and that is the bulbospongiosus muscle. This is actually the corpora cavernosa, which is actually covered by the ischiocavernosus muscle. So mainly they consist of cavernous spaces which is filled with blood, and these spaces are dilated and filled with blood during the process of erection. So coming to the nerves, they are the same posterior scrotal nerves. They are labial nerves, we call it as, here we call it as the posterior scrotal nerves. Then we have the nerve to the bulb of the penis. nerve to the bulb of the penis, and muscular branches which is supplying the ischiocavernosus, bulbospongiosus, and the superficial transverse perineal, and perineal branch for the posterior cutaneous nerve of the thigh. So the prudental nerve, as it passes, mainly it gives inferior rectal nerve, and then it gives the dorsal nerve of the penis, posterior scrotal nerves, and nerve to the bulb of the penis. So here you are able to see the nerves, mainly the posterior scrotal nerves. So the perineal nerve giving the posterior scrotal nerves, and then deep branch of the perineal nerve, mainly giving branches to the muscular branches, to the ischiocavernosus, bulbospongiosus, and transverse perineal. Then you have the dorsal nerve of the penis, so which is the continuation of the prudental nerve. Vessels, posterior scrotal or labial vessels, artery to the bulb of the penis, artery to the bulb of the penis, transverse perineal artery, urethral artery, artery to the bulb of penis, then deep artery of penis, and dorsal artery of the penis. Okay. So the deep and dorsal artery again are terminal branches of the internal prudental artery. On its course, it gives branches artery to the bulb of the penis and the urethral artery. Mainly glands and ducts. Apart from the muscles, we have seen the crux and the root of the penis. Then we have seen the nerves and the vessels. Ducts of bulbourethral glands. Bulbourethral glands are actually situated in the deep perineal pouch, but their ducts pierce and open along the sides of the spongy urethra. So their ducts actually pierce the perineal membrane, and they are opening into the sides of the spongy urethra. They are actually called as the ducts of bulbourethral glands. Finally, coming to the applied anatomy of the superficial perineal pouch, extravasation of the urine. So superficial perineal space communicates potentially anteriorly between the fascia scarpa and the external oblique aponeurosis. So in case if the urethra is ruptured, the spongy part or the penile part of the urethra is ruptured due to any trauma to the perineum, mainly it is called as the cycle bar injury, cavernous part of the urethra, then urine get collected in the superficial perineal pouch. Above it cannot go to the deep perineal pouch because the fascia of Colles fuses with the perineal membrane, so it is closed. So below it can get collect along the scrotum, penis, and it can enter into the anterior abdominal wall in the superficial inguinal space, which is between the fascia scarpa and the aponeurosis of external oblique aponeurosis of the external oblique abdominis muscle. Okay, so here you are able to see there is absolutely nil space, but once the urine gets collected, you are able to see it is filled with the superficial inguinal space. So that is the spread of root in case of the extravasation of urine when there is a rupture of the urethra, mainly the spongy part of the urethra. Okay. This is mainly in the deep extravasation. If the membranous part of urethra is ruptured, extraperitoneally it collects around the urinary bladder. That is in case of the deep extravasation. This is superficial extravasation in the superficial perineal space. So that is all about the superficial perineal pouch. Thank you very much for your patient listening.